Hi, this is Dr. Eric Codner with Southwest Georgia Center of Medicine in Americas and Columbus Physical Medicine Center in Columbus, Georgia. And we have patients come in sometimes with terrible, terrible headaches, migraine or cluster headache type head pain. And I tell you, there are some of the worst patients as far as pain levels I've ever seen. There's nothing more excruciating than a terrible migraine or cluster headache. And but getting very serious, some people don't consider headaches all that big of a deal. Oh, here, take an aspirin, walk it off, that kind of thing. One of the biggest negative outcomes of migraine sufferers is suicide. And yeah, that probably comes as a shock to you, but that's how bad this is, particularly with people that get locked in to the migraine where they just don't go away. They have them day after day after day. And it's terrible for them because average person may have had a migraine once, but it was one episode, no big, it was terrible, but no big deal, it went away. Imagine it never going away. Imagine just getting on maybe a little better on some days, but terrible on others, but it never really goes away. That's why some of these people end their lives over it. It is a very serious problem, and we take it very serious. It can make you depressed, being in chronic pain like that, and for whatever reason, there's a higher incidence of stroke associated with migraine now as well. So it's imperative to fix this problem if possible. And unfortunately, standard medicine does not have a good solution for it so far that I've seen. Putting you on a lot of drugs, some work better than others. I find that over time, they tend to wear off, the migraines come back. There's different reasons why women and men get migraines. Our typical migraine sufferer usually is a woman, but men certainly have them too. We find that spinal misalignment can be a big cause of it. You got to check that neck. I've had many patients where that's all we've done, fix their migraines for life. I've had others where it didn't do a thing to fix it. So then you got to look at hormones. Perhaps the hormones are out of balance. We've had another video on low testosterone. Check that out. It's really not about migraines, but it'll give you an idea of what we can do with hormone replacement. Women's hormones, since women do have the most number of migraines, are imperative, and we have to look at estrogen and progesterone. That's a whole nother topic. We'll have a video on that as well. We look at that, and as a way to treat the migraine, works very well. The final treatment we have is our SPGN block, and that stands for sphenopalatine ganglion nerve block. That's a mouthful, but the sphenopalatine ganglion is a bundle of nerves that comes off a cranial nerve. That means it comes directly from the brain. It's embedded in the deep sinus. Back in the old days, they used to try to deaden this nerve, inserting a needle through your face, through your sinus, and deadening that nerve with cortisone or some other drug, and it would work. It would fix the migraine and fix it for a long time, sometimes permanently. However, you could die from the procedure. Not a good trade-off, right? Well, we found a workaround to this. There's a neurologist who pioneered a different way to deaden that nerve, because it does work. The technique does work. It's just very dangerous the old way it was done. So now we have a syringe-like device with a special catheter. That means it's not a needle. No one's sticking any needles in your face. We put it up the nose, up the nostril. Sounds weird, but like I said, there's no needles. It does not hurt. It doesn't feel great, but it doesn't hurt. And we use a local anesthetic called Marcaine, bupivacaine. The Marcaine passes through the mucosal lining, the deep sinus, and hits that sphenopalatine ganglion, numbs it, migraine gone, or migraine's reduced. Sometimes it doesn't just go away immediately. I've had that happen, that we've certainly seen it go away immediately upon pushing that plunger. Others, it takes 6 to 12 visits to get rid of the migraines. And we're talking about getting rid of them, folks. I'm not talking about making you not have them for a day, or it gets better, or it gets from a 10 down to a 5. We're talking about getting rid of them. And typically we do other therapies as well, not just the block, but we also look at the hormones, we look at the alignment of the neck. All those things matter. So If you're suffering from migraines, don't wait. Pick up that phone, call us. Don't want to sound like a TV commercial, but these things you shouldn't have to put up with, and we have a great solution for them. So there will be other videos on both the hormones and probably one maybe demonstrating the SPGN block. It'll be coming up soon, so look out for that. Our number, if you're closer to Americus, 229-389-2038. If you're closer to our Columbus location, 706-330-1389. This has been Dr. Eric Codner. Thank you.